welcome back to my channel. So some of you guys asked me to make some ethics videos, especially that a lot of these are coming up frequently on the USMLE, and now they're making up a greater proportion of the test, especially after October 20. And I guess its percentage is also increasing in step 2. So today I brought I'm gonna touch on a specific ethics topic that I find the most confusing sometimes. And so I'm gonna walk you through 5 questions related to HIV and AIDS issues because a lot of these are confusing and stuff. And by the end of each question, I'm gonna take a paper and write down in red the take-home message of this question, because the thing about ethics is that you don't know what to follow. There is no specific curriculum or stuff like that you can follow. It's all about scenarios and how you assess it, which can be very difficult. And so what I'm gonna do is, after I walk you through each question, I want to help you figure out on your own similar questions when they come, just if you know the ethics principle that you should follow and you apply in all the rest of similar scenarios. Okay, so let's get started. The first question says, a 32-year-old pregnant woman comes to your prenatal clinic. She has a history of syphilis and gonorrhea in the past, and both of these are STDs, but her VDRL-RPR, which is the test for syphilis, is negative now, which means she's been treated for syphilis. An HIV test is offered as a routine part of her prenatal evaluation, as well as because of the history of previous STDs. So probably her doctor suggested that she should do an HIV test, not just because it's part of prenatal evaluation, but also given her history of STDs. You explain to her the importance of the test for her baby's well-being, because there is a 30% risk of transmission of HIV to the fetus. She refuses the test when offered. What should you do? Now, you gotta understand that a baby or a fetus is not legally a person until they are born, all right? And so any decision that is to be taken while a mother is pregnant should be her own. It's right now, even if she's pregnant, and even if any decision she would take would affect her baby's health, right now she's in control of her body, and even if that would affect the fetal health, she can still accept or refuse medical decisions regardless of how they will affect the baby. So this is the current ruling right now in the United States. And so what you should do is actually honor her wishes, which is that no test she has the right to refuse, all right? And so right now you consider her as if she's not pregnant, as if she is a person in control of her own body and stuff like that, like autonomy and stuff, because the take-home message here is that an undelivered fetus is that an undelivered fetus is not legally a person. All right, that is the current ruling. I'm not sure if it's right or wrong. This is just what you should know for ethics. And the other answer choices, like PCR RNA viral load testing as an alternative. It's not about the testing per se. It's not about the type of test. It's about an HIV test per se. She does not want an HIV test regardless of the type. Consent for HIV is not needed in pregnancy because it's to protect the health of the baby. Again, we mentioned that an undelivered fetus is not legally a person yet. So they have no, it's not like a born child, for instance. For a born child, for instance, parents cannot refuse emergency treatment for their children. But here in this case, even though it would affect her baby, because the baby is not born yet, then they are not a person yet. That's the thing, okay? Add the test to other routine tests that are to be drawn. That will be inappropriate, actually, and unethical because she has refused it. And now you're adding it without her knowledge. Administer empiric antiretroviral therapy to prevent perinatal transmission. Remember that these drugs still have their own adverse effects. You can't give them just prophylactically. She might not have HIV after all. HIV testing is not part of routine prenatal care and no specific consent is needed. Now, this statement is untrue because even though there is implied consent with taking blood samples for anything else like complete blood count and like finding out any routine blood analysis, you expect the patient expects you to withdraw the sample and they don't need a written consent for that. But with the exception of HIV, something you need to know is that there is no implied consent in terms of HIV regardless, which means anything regarding HIV must be expressed in writing. This is probably the only blood test that requires a written consent. Okay, it's not a routine blood test. All right, so this is, as we mentioned, the take-home message from this question is that an undelivered fetus is not legally a person. Okay, moving on to the next question. You have a patient who is an HIV positive physician. He has recently found out that he is HIV positive. He's very concerned about confidentiality, and you're the only one who knows he is HIV positive. He asks you who you are legally obligated to inform. What should you tell him? Now, just like you treat patients without asking them or regardless of their HIV status, you treat patients and you practice with them the universal precautions or the standard precautions in order to prevent infection, assuming everyone is HIV positive. The same goes for a patient and a physician. So a physician doesn't ask a patient about their HIV status before treating them, and so should happen with the physician, which means that a patient doesn't have the right to know the HIV status of their physician. So it works both ways. Okay, any patient with HIV or doctor with HIV, like any person with HIV, has a right to privacy as long as they're not putting others at risk. So as long as the physician is practicing the standard precautions, the universal precautions, and taking care, they should not, or they're not required or legally obligated to inform anybody. So no one without his direct written consent, no one should know. All right, and so the take-home message from this is that any person with HIV has a right to privacy as long as they're not putting others at risk. All right, as long as they're not putting others at risk. Okay, moving on to the next question. You have an HIV positive patient in need of drainage of a dental abscess. So you are probably the dentist or or you are the physician, the treating physician, and you have an HIV positive patient in need of drainage of a dental access. Obviously you are not a dentist, so you have to send him to a dentist. So there is a dentist in your multi-specialty group practice. He knows you're an infectious diseases HIV specialist, so the dentist probably expects that all patients you refer to him are probably HIV positive. That's the thing, your office manager tells you the dentist and his staff are scared of your HIV positive patients and they don't want to see them. Okay, so what is your response? This is illegal. The dentist liable and can be sued. No, guys, refusal to see a patient because of HIV is unethical. It's unethical, but it's not illegal. All right. You contact the medical director and have him instruct the dentist to see the patient. Now, one thing I need you to understand, and this is probably the take-home message from this question, is that the doctor-patient relationship must be entered voluntarily on both sides. So, just as you will not force a patient to go to a physician, the same goes on the other side, that a physician cannot be forced to see a patient if they don't want. Okay, this is probably something not everyone knows, but it's true. A doctor-patient relationship must be entered voluntarily on both sides. All right, so a physician cannot be forced to see a patient, and a patient cannot be forced to see a physician, which means that what he did is unethical, but you can't sue him because it's not illegal, right? And at the same time, you can't force him because, again, this relationship must be entered voluntarily. Okay, so no one, even the medical director, no one should force the physician, the dentist, to see the patient, and so this is incorrect. You prescribe the use of oral antibiotics alone instead. Now, the boards will try to confuse you guys to choose an inadequate medical treatment in order to avoid an ethical dilemma. But you gotta understand, and you keep what you know in mind, and don't get confused that you know that oral antibiotics alone are not enough, and this is an abscess that has to be drained, right? So you can't compromise that just because the dentist refused to see your patient. Okay, so don't accept a mediocre medical treatment just to avoid ethical dilemmas. All right. And so the correct answer actually is to refer your patient to another dentist outside of your group practice. And hopefully that other dentist can accept your patient even if they're HIV positive, because it's unethical to refuse them just for that reason. You might refuse, it's okay to refuse a patient, maybe because you're incompetent in doing such an operation or whatever, but to refuse the patient on the basis of HIV status alone is unethical. Okay, so we already discussed the take-home message of this, that the doctor-patient relationship must be entered voluntarily on both sides. All right, moving on to the next question. You're evaluating a new patient that has come to your clinic for management of his HIV infection. He has a high CD4 cell count and a low viral load, which means in good state, and does not require treatment. He is married and does not practice safe sex with his wife, and his wife is unaware of her husband's HIV status. Now, both this and the coming question, they kind of discuss similar ethical principles. So we're gonna put one take-home message for both. So what is your duty? What is your duty right now, whether to protect the patient's privacy or to tell the wife? Remember, anything in ethics cases that has the word encourage, like anything that is like of courtesy, you have to choose it, okay? Don't jump to conclusions. Don't jump to legal stuff quickly. That's usually not really the correct answer. So, to encourage the discussion between the husband and wife, I strongly suggest he disclose his HIV status is the correct answer. Now, remember that a physician is not legally obligated to inform the partner of their patient's HIV status. You are not legally obligated for partner notification. And so the first thing you do is to encourage your patient to inform their partners first. Okay? It is, however, the responsibility of the Department of Health to inform the partner. You do not inform the partner, because if you do inform the partner at first without encouraging discussion, so the step number 1 is to encourage discussion. Okay? If that doesn't happen, okay, you inform the Department of Health. All right? And the Department of Health informs the partner. So that's how it goes, okay? So step number 1 is to encourage the patient to inform their partner. But you don't go ahead and inform the partner right away and skip all this. So that's the thing, okay? So step number 1, encourage the husband, the discussion. And then step number 2, if they don't, okay, you can inform the Department of Health. The Department of Health informs the partner. Now, if the Department of Health, if you don't do this step and you've actually stayed at step number 1 for long, and you kept encouraging and the patient doesn't want to inform their partner, and then you see the partner, okay, then at that time, and you know the partner is at risk, then at that time you can inform, but only after it's too late, like after repeated warning, okay? And we're gonna touch on that in the other question. I'm gonna tell you now. So what about the other answer choices? You must keep his HIV status entirely confidential at all times. I'm gonna talk about that in the take-home message. Have the city Department of Health inform the wife. Yes, this is at step number 2. This is not step number 1. And so your duty right now at this stage is to encourage discussion. And there is no need for partner notification as long as they're practicing safe sex. They already mentioned the question that they do not. So this is probably irrelevant. Now, for the next question, which is very, very similar, you have an HIV positive patient in the office. You ask her if she has informed her partner that she's HIV positive. She has repeatedly resisted your attempts. Now, that's important. In the above case, it was the first time, okay? And therefore, your first duty right now at that stage is to encourage discussion. But here, you've already done that a lot, and she repeatedly resisted your attempts to have her inform the partner, okay? She's pregnant with his child, which means they practiced unprotected sex. The partner is in the waiting room, and you have met him many times. What do you do at that stage? At that stage, it's too late. And the take-home message here that I want to tell you is that the safety of an innocent person is always more important than privacy, okay? And that's part of Tarasov case, I guess, something like Tarasov, that if you know someone's gonna hurt someone else, now is the time to break confidentiality, right? And it's obvious here that she did hurt him. You are legally protected. And there's another thing I want to touch on as well, is that even though you're not obligated to inform the partner, but you're legally protected if you do. Like, no one can sue you for breaking confidentiality because you want to protect the partner. No one will sue you for that. But he will definitely sue you if you knew that the patient had HIV and you didn't tell him, and then he got HIV, for example, then you are liable, okay? So safety comes before privacy, but only at a certain stage. I wouldn't, for instance, do that here. Here, it's the first time I know. It's our first meeting. I didn't yet encourage discussion, so this is you take it step at a time. I don't go ahead and inform the partner right away, right? And you're not even required to do that, okay? But here, what should you do? You should inform the partner now. At that point, her confidentiality is not as important as his safety. Right now, he's possibly HIV positive because, as you can see, she's pregnant with his child. So, again, you are not okay. What you should do ethically is to inform the partner now. But again, you're not legally obligated. There's something you need to understand. You, no physician, no legal obligation to inform the partner. Even at this stage, you're not legally obligated. However, because of the Tarasoff law that says that the safety of an innocent person is always more important than privacy, and you will not be liable if you break the confidentiality at that point. You're not, no one can sue you for this, okay? But someone can sue you for knowing that about HIV and you didn't tell them, okay? So because taking the lesser of the two evils, I would choose to inform the partner, of course, okay? Protecting an innocent person. No one, the patient cannot sue me for telling her husband, but her husband can sue me for not telling him, and then he gets HIV, even though I knew and I didn't tell him, and in that case, I will be liable. Here, you are protected. You are legally protected, okay? So I hope that makes sense, guys. If you like this video, you can tell me in the comments if I should make another similar video, like another episode of ethics about different topics. And I hope this helped, and don't forget to subscribe. Thanks for watching.